This is a combined station that will assess the candidate's ability to initiate a peripheral IV line and then administer a bolus of a medication given a patient scenario. There are no additional rescuers required for this skill. Candidates have 6 minutes to successfully initiate an IV line.
Because this is a combined station, if you're unable to initiate the IV line, you'll also be unable to administer the medication bolus. So it's important to make sure that you can establish and maintain a patent line. You'll have 3 attempts within the time period. Don't get discouraged if you're unable to initiate the IV on the first attempt. Simply explain how you'd remove and dispose of the needle and catheter, and then reattempt the IV.
Candidates at this station will have equipment and supplies necessary to establish and maintain a peripheral IV. These items include IV catheters, administration sets, tourniquet, tape, sharps container, and medical exam gloves as part of the necessary personal protective equipment. The main sections of the IV therapy station involve fluid, catheter, and administration set selection, site selection and preparation, venipuncture, and securing the IV line and adjusting the flow rate.
Welcome to the IV and Medication Skill Station. The first part of the station is designed to evaluate your ability to establish a patent and flowing IV. You have a maximum of 3 attempts within a 6-minute time limit. You have had the opportunity to check your equipment. Do you have any questions?
No, I'm ready to go.
Okay, we will begin. You are treating a 54-year-old male who is weak, lightheaded, and dizzy. He has a cardiac history and lung sounds are clear.
Okay. I would choose fluid of normal saline, 500 bag. I would make sure that it's clear, that it's in date. I'd use a macro drip set. I would try to use an 18 gauge needle. Go ahead and spike my bag. Make sure there's fluid in the chamber. I would tear my tape. At this point, I would want to utilize BSI precautions. I would apply a tourniquet. Choose my site. Cleanse the site in a circular motion. Make the puncture. Felt a pop. I see flash. Occlude above the site. Needle out. Needles in the sharps. I would open the IV to make sure that it runs. Then I would secure it in place. And I'll adjust my rate to KVO.
Is there anything else you would like to do for this station?
No.
Begin the station by selecting the proper fluid, catheter, and administration set for the patient's condition. Connect the IV tubing to the bag. Fill the drip chamber and flush the tubing. Prepare tape. Verbalize BSI precautions. Apply the tourniquet. And palpate a suitable vein and cleanse the site. Perform the venipuncture and observe the flashback. Occlude the vein proximal to the catheter. Remove and dispose of the stylet. Connect the IV tubing. And release the tourniquet. The final steps in this station are to secure the IV and adjust the flow rate for the patient's condition. With the scenario complete, the examiner checks the candidate's performance against the critical criteria for the station. The critical criteria for this station that would have resulted in failure were failing to initiate a patient and properly adjust IV within a 6-minute time period, failing to take or verbalize the use of body substance isolation precautions, contaminating equipment or site without correcting the mistake, performing an improper technique resulting in a potentially serious problem, such as uncontrolled hemorrhage, catheter shear, or air embolism, failing to establish an IV within 3 attempts, and failing to dispose of the needle in a proper sharps container.
Many ALS providers have a preferred site that they often use when starting IVs. For this station, use the vein that you can most easily see and palpate even if it is not your preferred choice.